Will the Committee of Supply please come to order? This section of the Committee of Supply will now resume consideration of the estimates for the Department of Mental Health and Community Wellness. Questioning for this department will continue in a global manner. The floor is now open for questions. The member from Point Douglas.
Miigwech. So I just have a few undertakings for the minister. I'm hoping that the minister can undertake to give a list of all technical appointments in her department, including names and titles.
The Honourable Minister of Mental Health and Community Wellness.
Thank you. So there are two technical appointments. Danielle Orvis is the executive assistant and Laura Gutermson is the special assistant.
Member from Point Douglas.
Miigwech. Can the minister undertake to give an organizational chart that lists all employees and program areas?
The Honourable Minister.
Thank you. If the member would go to page 14 of the supplemental estimate. Oh, there we go. Okay.
The member from Point Douglas.
Yes. So I am aware of page 14, but what I'm asking for is a breakdown of all employees as well as program areas. So this is in the department, but I'm asking for organizational chart with all the employees and the program areas. And if the minister can undertake that, that would be great because it's not in this and I'm sure it's going to take time to put that together.
The Honourable Minister of Mental Health and Community Wellness.
Okay, thank you. So there are 3 admin, 2 tech, 1 deputy, and under the deputy there are 2 admin and 1 policy person, 2 ADMs, and under the 2 ADMs there are 2 executive directors, 4 managers, 2 collective policy analysts. In total, there are about 75 employees.
Member from Point Douglas.
Miigwech. I did ask if the minister would provide an organizational chart that lists all employees as well as program areas. So if the minister can undertake that, I know you've given me some of that, but again, employees, all employees and program areas. So programs that are administered by the department.
Pretty basic question. Yes. The Honourable Minister.
Hi, so we can provide the chart and the different program areas, but the employee names are not included on the chart. Okay.
Member from Point Douglas.
Yep, and that's fine, if the member or the minister can undertake that. So my next question, can the minister give a list of all current vacancies in the department as a number and a percentage?
Okay.
The Honourable Minister of Mental Health and Community Wellness.
Thank you. Okay, so as of March 31st, 2020, the executive has 14.5 total full-time. Total filled are 14, total vacancy 0.5. The mental health and recovery as of March 31st, 2023 has 33.7 total full-time. Total filled are 31.9. Total vacancy 1.8. Wellness as of March 31st, 2023, 14 full-time, total filled 13, total vacancy 1, with a total as of March 31st, 2023 of 60.2 full-time, total filled 58.9, total vacant 1.3 or 2%.
The Honourable Member for Point Douglas.
I thank the minister for those answers. Yesterday, I asked about the 1,000 beds and how the government defines addiction treatment spaces. If the department says they're investing in 1,000 spaces, is 1,000 different spaces or spaces that they can serve 1,000 people? For example, 1,000 spaces serves 10 people. each.
The Honorable Minister of Mental Health and Community Wellness.
Thank you. I'd just like to remind the member that in the November 15th, 2022 throne speech, it stated our government was committed to increasing and supporting 1,000 treatment spaces in the province to ensure everyone who is seeking treatment had access to the supports. The reason for the commitment to spaces is that not all services required are bed-based. We know we need a continuum of addiction supports in the province. So for example, mobile withdrawal services are offered in a person's home. Intensive day programming is not a bed-based treatment. It's not all in the facility.
The Honorable Member for Point Douglas.
Miigwech. So the minister claims that the province is investing in 1,000 treatment spaces. It's even written on page 20 of the estimate books, yet the government's own request for expression of interest posted on MERX makes it clear what 1,000 spaces actually means. On page 2 it says, this initiative will enable up to 1,000 treatment spaces, people served, to receive substance use, addiction services. A table makes it even more clear in the same document. The province is looking to build 155 spaces, not 1,000. Can the minister explain? Does she think it's misleading when she says the PC government is going to build 1,000 spaces, when in reality it's far less?
The Honorable Minister of Mental Health and Community Wellness.
Okay, thank you. So no, that is not misleading. That is how you measure or track the capacity in the system. So 300 of the 1,000 treatment spaces have already been announced, and the additional capacity is being purchased through Shared Health and the Regional Health Authority, yet to be announced. So the remaining amount went out through the expression of interest, and it would go through supportive recovery housing, adult bed-based treatment services, multifunctional bed-based transition supports, and intensive day programming.
The Honorable Member for Union Station.
Thank you. Could the minister repeat the first part? Would you actually mind repeating your entire response? I missed the first part. I want to make sure that I've captured it properly.
The Honorable Minister of Mental Health and Community Wellness.
No, it is not misleading. The measuring and tracking of the capacity in the system, and then we've already announced 300 of the 1,000 treatment spaces. And then the additional capacity is being purchased through Shared Health and the Regional Health Authority, and that is yet to be announced. And the remaining number of spaces, treatment spaces, went out through an EOI for supportive recovery housing, adult bed-based treatment services, multifunctional bed-based transition supports, and intensive day program.
The Honorable Member for Union Station.
Can the minister clarify, did she say that the remaining spaces are to be purchased through Shared Health? And then she said something subsequent to that. So was it EOI that I'm not clear. What does that acronym represent that she's saying?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. EOI is expression of interest.
The Honorable Member for Union Station.
So I think it is misleading that the minister and the province would say that they're creating 1,000 new spaces, when in reality, when you add the numbers up, it doesn't appear that those are actually 1,000 new beds, which I'm sure they're aware, the general public, that's how they interpret it. And I'm also very curious to know about timelines, because it's a big announcement. This minister is saying they've already announced 300 of those 1,000 beds, and there's going to be an expression of interest for others and more to be purchased through Shared Health, et cetera. But that doesn't provide any comfort to families whose family members cannot access beds right now. And there's no clarity around when folks who are in need of those beds that don't truly total 1,000 are going to be able to access those services. So with that in mind, because we know the reality of it is that Manitobans are not only being turned away from services that this government purports to be meeting the need, like RAM services, which turn away many Manitobans who are in desperate need of care. We also know that folks are waiting to be able to access treatment beds, and treatment being detox bed or longer term treatment. So I'm wondering if the minister can provide clear information around what the average wait time is for someone who does have to wait to access bed-based addiction services. And if the minister could articulate, what areas those waits are in. Is it for detox beds? Is it for longer term treatment? How long on average are those folks waiting to access the varying types of beds that are available? And breaking that down by what is the top 10% of wait times, just as an example. And with that in mind, has the department set a goal to reduce those wait times? Maybe I'm being a little greedy. I see the minister nodding and loading a lot into that question, but thank you.
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So I just want to begin by stating it's treatment spaces, it's not beds. So when we said 1,000, we meant treatment spaces. That's what we're advertising for. And not all the services that are required are essentially bed-based. There are other services that an individual may need to access depending upon where they are. We have home services, the mobile withdrawal unit services, so individuals, if they're unable to access a service, are able to take the services in their home. If they have children, they can take services at their home. Days, evenings, services provided go to the needs of the individual so that we can assist them at the level that they're needing the support for. With RAM clinics, we've announced 6. There is a 7th to be opening, which is 7 more than were previously in place prior to those. So we've done 7 RAM clinics, and the roadmap identifies the needs for consistency in reporting for the targets for individuals. So we use the roadmap.
The Honourable Member for Point Douglas.
Miigwech. So I think the question was pretty clear. It asked, how long on average is someone waiting to access treatment beds? And the minister outlined, you know, the RAM clinic, which we know like 3 to 4 people get into a day. There's all sorts of ramifications with that in terms of someone that's ready to get into treatment and going there and being turned away, or an appointment being made. We know that there's not enough beds for folks to actually get into recovery when they're ready to get into recovery. So the question was, what is the wait time and what is the top 10% of wait time? So if the minister can provide that, that would be great. And what is the goal? It says to reduce it by 5%.
The Honourable Minister of Mental Health and Community Wellness.
Thank you. I think it's a little concerning that the member opposite doesn't support RAM clinics and the work of the service providers that they provide for the community. The wait times to access withdrawal management services vary and fluctuate depending upon the program, the number of people requiring the service at that time. Wait times can range from immediate access to up to 1 month. The wait times for bed-based treatment beds vary significantly between programs and change on a month-to-month basis. And wait times for supportive recovery housing units also vary significantly between programs and are dependent upon the flow of residents in the independent housing.
The Honourable Member for Point Douglas.
In nowhere did I say that I did not support RAM clinics. I've had RAM clinic staff approach me and talk to me about bringing their voice to the Manitoba legislature because they have to turn people away, and there's been people that have left there and have lost their lives. So I want to be clear. I support RAM clinics, but I support them with more resources. They're under-resourced. They're only open a certain amount of hours a day. They're not able to get folks into treatment right away. They're often given, their hands are tied. Folks that are there have to wait in line at like 5:30, 6 in the morning. And staff are saying that they're only able to take 3 or 4. And many times that those folks that are coming in, they have to give them appointments to come back, and then they don't see them again. There's a certain amount of window that they need to be able to get into treatment. So again, I'll ask the minister, and I find it problematic that the minister can't even give us an average. Like, they're saying it's an average of a month. Well, how many people are waiting for how long for bed-based addiction services? And it says the goal is to reduce it by 5%. Again, bed-based addiction services. So I'll ask the minister again, how long is someone waiting to access bed-based addiction services? What's the top 10% of wait times? And the department has set the goal to reduce the wait times by 5%. Where is the department on that?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So there is no central wait list for services. The services are provided by many community agencies, and they have their own unique criteria for admission. So when we're speaking about wait times, we tend to speak as an average wait time to get into a facility. The 5% target that you're referencing is a measure that would be projected for the end of 2023, 2024, once everything has been put in place with the 5% wait time. So some of the numbers, I can give you some of the numbers for wait time. So we have RPC Men's Day Program is 38 days. The Compass Male, 37. Compass Female, 35. There's more numbers I don't have on your screen. Sorry. Problem Gambling, men 35 days, women 35. And Brandon Parkwood, female, wait time is 65 days.
Just a friendly reminder before I,
Sorry.
we're doing very well here, but just to keep it in line, we should, go through the chair so that way it doesn't, lead into anything. So thank you very much. The honorable member for Point Douglas.
Miigwech, thank you for that reminder. I would ask the minister if they could actually undertake to provide a breakdown for each program that the department supports, whether that's through Main Street Project or Salome Mission or Behavioral Health Foundation. I'm sure that, those organizations report to the department on how many folks are accessing their services, how many folks are waiting to get into those services. The minister also referenced they've already created 300 of the 1,000 spaces. So I'd also like the minister to undertake or let us know where those 300 spaces are. And the minister also talked about that's a 2023-24 projection. We're in a couple of months, and certainly 300 beds would start to break that 5% down. So if there's 300 beds now, where are those beds? What's the impact? And if they can undertake again to provide the numbers for the different treatment spaces that they provide funding to.
The Honorable Minister of Mental Health and Community Wellness.
Thank you. For the 300 spaces, so up to 300 spaces were announced for Prairie Mountain Health for Brandon, for Portage with Shared Health, Southern Health, and Interlake Easton Health in the Ashern Hospital. The information of the wait times and that is not something that is shared, so I would direct the member to go back to each of the agencies that she's seeking this information from and ask them for it.
The Honorable Member for Point Douglas.
I find it problematic that the minister wouldn't have access to those average wait times from organizations that they actually provide funding to, because ultimately they report to your department. And, you know, if there's a greater need, which we know that there is, and we know that these wait times, and we still haven't, you know, been given an answer from the minister on what the actual wait times are, the average wait times for, you know, across Manitoba. We've heard announcements of beds. We don't even know if those beds have opened up. We know that there's no services provided for folks that are actually sitting on a waiting list, that they're just left without any support. And some have not even made it to recovery and have lost their lives waiting to get into detox or treatment, which is, you know, very disheartening. So I would, you know, suggest to the minister that they should be consulting and actually looking at these numbers and actually looking so that it guides them in the direction that it's going to reduce these wait times. If you have a 5% goal, how are you meeting that goal if you're not even looking at these numbers? And you're sent me to Justice yesterday for the medical examiner. Now you're asking me to go to these different organizations to get these numbers that the minister should have access to. Like, these are Manitoban lives. These are people that are waiting to get into treatment. And we're playing with, you know, here, go there, you go get the numbers yourself. It's not for me. I'm asking for actually family members that are waiting to get their loved ones into treatment. And I shared yesterday, my brother-in-law was in treatment 3 times, came out, no services offered, no wraparound services. While he waited to get into treatment, he lost his life. So these are very important questions that I'm asking. They're not questions that are just, you know, I'm trying to catch the minister in some kind of web or anything. These are people that are actually waiting and need to know how long they have to wait to get into treatment. You know, I've been speaking to a mother today that's watching these proceedings, and they want to know. You know, you gave a few numbers of some day programs, 68 days to get into a day program. How long is it to get into a bed-based program where actually you get the supports that you need? So whether it's 30 days, whether it's 60 days, whether it's 90 or 6 months, or up to a year. Those numbers should be available to the minister, and the minister should be accountable to Manitobans and be able to provide those numbers. You know, it's very disheartening to sit here and hear the minister say, well, go to Behavioral Foundation, ask them how long their wait time is. Go to Main Street Project. Like, your government. Our job is to ask these questions and to get answers. And I don't understand why the minister wouldn't want to provide those answers. Those answers are going to help guide the response. You know, you're saying 1,000 beds. We probably need double that, if not triple that. So I'm going to move on from that, but I just wanted to state that. So on page 24 of the estimates book, it says that the department prepared draft legislation and regulations on the subject of licensing public and private addiction organization. What has the minister heard from the addictions organizations on these proposed changes? And does the minister think that the fact that frontline community organizations universally oppose their proposed licensing regulations, as these regulations would have hampered addiction services? I did these two for time.
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So I just want to go back to the members' previous comments. The information on wait times and services we have, but it is confidential and it is not for the department to share. There is also an expectation that part of the standards to be put in place would have been put in place with the bill that we presented, but the bill was stopped by yourselves. So we absolutely cannot share any information because it is not universal for individuals to have access to that knowledge. Would like,
Oh, the Honorable Minister of Mental Health and Community Wellness.
okay, thank you. And to have the member repeat the question.
The Honorable Member for Union
I
Station.
just want to get clarity. So the minister is saying that the wait times, which at first she stated they didn't have access to, now the minister is clarifying they do have access to the information around wait times, but that that information is confidential and cannot be shared beyond the department. What mechanism is it? Is it a part of an act? What is it exactly that precludes the minister from disclosing what those wait times are? The minister also just stated that Bill 33 would have established standards that would have allowed for the minister would have allowed standards that would have allowed the minister to make public that information. So what is the mechanism specifically that is preventing the minister from being transparent and providing the information around wait times right now and generally as stated by the minister?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So not naming the individual organization and the wait times is confidential, and we don't want to share that on public record. And the public reporting of the aggregated wait list is a priority of the roadmap. So if we get the roadmap in, we'll put the aggregated numbers on there.
The Honorable Member for Union Station.
Thank you, Mr. Chair. So I see that the minister has abandoned her narrative almost immediately, effectively immediately. So the minister stated that the information was confidential and that couldn't be provided and would have been able to be provided if we hadn't stopped a bill they brought forward. Yet in her response to my question, for her to identify specifically what is the mechanism that is precluding the minister from providing this information, there's no clarity around what that mechanism is. Is it a piece of legislation? Is it something somewhere that we should be talking about? And the minister also makes no mention of the legislation she claims would have been a way for them to actually provide that information. So that is a bit, from my perspective, that's a bit concerning, because it reflects that for whatever the reasons are, the minister isn't wanting to be transparent about why it is or what it is that she says is preventing them, that is resulting in this information being confidential, which is a pretty strong statement to say that that information is confidential, but to not clarify what makes it confidential, what is preventing her from providing it, when, you know, we've asked questions along those lines in other estimates committees, and that information is readily provided. And if it's not available immediately, it's undertaken to be provided at a later date. And so I'm concerned that there's some potential mechanism in place here within this particular department that isn't allowing the minister to provide that information, yet the minister won't provide clarity as to what that mechanism is. Further to my point regarding this legislation that the minister did bring forward that, yes, we have stopped, I think it's important to talk about the fact that frontline community organizations, service providers, community health providers have been unified. Medical experts, doctors have been clear that that legislation would directly impede and harm the efforts of folks who are providing life-saving healthcare to those struggling with addictions. You know, myself, everyone I think is well aware I am a nurse by background. I'm a psychiatric nurse. I'm also an addiction specialist. I'm somebody who has trained hundreds and hundreds of Manitobans to provide care to family members, to people across the province struggling with addictions, folks struggling with co-occurring disorders, so mental health disorders and challenges alongside addictions issues. And through all of my training, years of training, education, frontline experience as a healthcare provider, working with families, I would not position myself as somebody who should be the be-all, end-all on what legislation should look like to best help families. I recognize, as we all should, that there are a number of experts, organizations, frontline service providers, workers, who should be informing us, who we should be working with to make sure that we're doing what is necessary and evidence-backed to save lives of those struggling with addictions and provide them the services and supports they need. And so I think it's really concerning that the minister continues to try to condemn or criticize not us in opposition, because what the minister is actually doing is being critical and condemning the very people that we thank for saving lives in our province. They're the ones who have been unified in their criticism of this government bringing forward legislation, licensing, regulations that would directly impact the ability of folks to support those in communities who desperately need it. And so what does the minister have to say to those organizations? What does the minister have to say about her position that she opposes the experts and the frontline community organizations who have made clear that the licensing regulations that this minister has brought forward would have hampered, would have interfered with, would have harmed addiction services? Does the minister think that all of those folks are simply wrong and that it's her perspective that matters most. What's the minister's position on that?
The Honourable Minister of Mental Health and Community Wellness.
Thank you. So I want to begin by saying that I am not condemning or critical of services, and there is not unanimous consent. Recognizing frontline workers and the work that they do to support the individual seeking the support from service providers is very important. And I have met with frontline workers prior to and as the minister of this portfolio. And I do not contradict myself when I'm posting wait times. Oops, sorry. Interests are provided accurate information to Manitoba's agencies, are not calling them out by specific name. And then just to further correct, it's a small group of critics, but I would not agree there is a unified perspective. We have strong supports from organizations and experts on the standards and associated legislation. Yesterday, the critic described all of the services that are ideal in a supervised consumption site, none of which are a requirement to receive authority to operate a site. I think we can all agree we need to make these sites as safe as possible and help connect individuals to care. The only way to do this is to ensure clinical staff are available on site, and there is an expectation on organizations to help connect individuals with mental health and addiction services, all of which were the foundation of the bill.
The Honourable Member for Point.
I just want to,
Sorry, I may not have had my mic on. The Honourable Member for Point Douglas.
well, I'm very disappointed in the minister's response to that because there are 80 organizations, a number of doctors who wrote to the minister opposing that bill and really outlined how it would impede the work that they're doing in terms of saving lives in Manitobans. I encouraged the minister yesterday to go visit a safe consumption site, to actually not walk by like the predecessor and take pictures, or like the premier saying that, you know, she visited a safe consumption site in a place where there is not even a safe consumption site, misleading Manitobans, both the predecessor minister and the premier. And now we have a new minister. So this minister has an opportunity to do the right thing, to help save Manitoban lives. And I encourage the minister to go visit those 80 organizations that are on the front lines, that are doing that work, life-saving work, to go and meet with them, to actually go and tour, as well as go and tour the mobile overdose prevention vehicle. They were just here last week. You know, I came, they've been doing life-saving work. So I'm going to move on from that, because we're not getting any answers, which is unfortunate, because, you know, if I go onto a website and I look, if I want to go to an urgent care, I can see how long the wait times are. I can go and see how long a wait time is for surgery. I can go see how long a wait time is to get into an emergency room. But yet there's nowhere that anyone can access wait times. And I wasn't asking the minister to provide site by site. I simply asked, like, you know, you're providing funds to these organizations as a collective. In all of the organizations that you provide funding to for bed-based treatment, what was the average wait time? So I wasn't asking for names. I was simply asking for the average wait time. And then the minister said there was policy, and that this, you know, bill would have allowed that to happen. Then the narrative shifted. So I'm going to move on, because clearly, you know, the minister doesn't want to provide those answers to Manitobans, and Manitobans want to know those answers, should know those answers, should have confidence in their government that they're being transparent, and that someone that wants to access treatment should know how long it's going to take them, or how long a family is going to have to wait to support this person, this individual, before they get into treatment. There's no services before they get into treatment. People are dying before they get into treatment. They're dying after they get out of treatment, because there's no wraparound services. So I'll move on. My next question has to do with HIV cases in Manitoba, and if the minister can provide how many HIV cases were recorded in 2022 and how many were a result of using drugs.
The Honorable Minister of Mental Health and Community Wellness.
Thank you. Okay, I just want to put on the record that I have spoken to and visited some of the agencies on that list, and I have actually toured the overdose prevention site. So, and if you could repeat your question, sorry.
The Honorable Member for Point Douglas.
Miigwech, my question was how many HIV cases have been reported in 2020 and how many were attributed to drug use? But I'm also going to put another question in there just for the sake of time. And it's nice to hear that the minister has actually visited the mobile prevention site, and that, so I'd ask the minister, one of the reasons why safe consumption sites are so important and help save lives is that they provide people with clean needles so that bloodborne diseases aren't being transmitted, such as HIV. Does the minister agree that safe consumption sites would help reduce the spread of diseases like HIV, syphilis?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So HIV falls under health, and you need to speak with public health on this issue. That being said, the Department of Mental Health and Community Wellness and Manitoba Health work collaboratively to address harms related to substance use and provide policy, planning, funding, and oversight to HR initiatives. Departments work together to integrate policy interventions, including training for health and social service practitioners, improve data transparency, and enable collaboration between service delivery organizations and community-based organizations. Mental health and community wellness invests almost $1.5 million annually in harm reduction initiatives. These initiatives include support for harm reduction-based organizations, providing safer sex, safer substance use supplies. Overall, the government invests over $2.2 million in harm reduction, $1.5 million from mental health and community wellness, and $700,000 from Manitoba Health's take-home naloxone kits. Other investments that we have are $210,000 for the take-home naloxone kit with over 200 distribution sites. On November 1st, 2022, we announced Narcan pilot program, which invested $200,000 to make Narcan nasally administered form of naloxone accessible through RAM clinics. Invested almost $215,000 in funding to support St. Boniface Street Links outreach and supportive intervention for people who use substances. The OASIS project is led by a multidisciplinary team and will provide support to approximately 80 people experiencing homelessness and are struggling with substance use. And on December 16th, 2022, we also publicly released substance-related harms data, including information on fatalities due to drug overdose, substance use, hospital admissions, emergency department visits, substance-related calls responded to by the Winnipeg Fire and Paramedic Services. The department has also made significant investments in clean needle programs.
The Honourable Member for Point Douglas.
Miigwech, we often hear this notion of whole of government approach, but yet what I'm hearing from the minister is yet again shirking the responsibility to another department. The minister should wholly have these numbers at their disposal. It should be something that is guiding their response in their department, because it is a leading cause, drug use, in terms of some of these bloodborne diseases, especially HIV. So how can you properly, service these agencies and know actually what's happening if you're, leaving it with health? Like, it is a responsibility of your department, not health. And when we look at the medical examiners, and I think the minister is just as frustrated as I am, and maybe could direct their staff to, find those numbers. If they're on the Department of Health's website, then perhaps the minister can ask the staff to find those numbers and provide those numbers. It's not, this web that we're trying to entangle you in. We're trying to find physical numbers for Manitobans to actually get the information out. People don't know how much HIV is rampant, and the symbiotic relationship between syphilis and HIV that's happening in our province, because our government is not doing anything to let the public know. So again, it's frustrating to hear the minister continually say, go here, go there, when this whole of government approach obviously isn't a whole of government approach. It's this department does this work, and I don't know anything about what that department does. I don't have the numbers. It's very frustrating, to say the least. And I just want to remind the minister that there are people watching these proceedings. They do go in to read committee reports. They are looking for answers, especially our frontline organizations, that help, these numbers help guide their response. And these numbers should be helping guide this government's response. And I hear, these numbers being thrown out of, yes, we're providing this, but these numbers are trending up. So obviously not enough is being done. And how can you know what the response can be if you're not even looking at the numbers? You're saying, oh, that's health. Let health deal with those HIV numbers. I'm asking specifically, if you don't want to provide the numbers of how many people were, how many people contracted HIV, perhaps the member or the minister can provide how many individuals contracted HIV through drug use.
The Honourable Minister of Mental Health and Community Wellness.
Thank you. So I will agree with the member opposite. We do have a whole of government approach and tables where departments work closely with other departments, including health, justice, to release the data online. That's including the overdose data and the HIV rates. For 2020, there were 117 cases of HIV new to Manitoba, compared to 119 in 2019.
The Honourable Member for Point Douglas.
So the minister just gave numbers for 2020, and we had the second highest rate of HIV nationwide for 2020. I did ask for the numbers for 2022, and the numbers for how many were a result of using drugs. So if the minister could provide those.
The Honourable Minister of Mental Health and Community Wellness.
Thank you. The question I had heard was 2020, not 2022, so I'll see if I can get you that.
The Honourable Member for Point Douglas.
Okay, I appreciate that. I might have said 2022. I apologize. So I'm going to move on while the minister is looking for those answers to the suicide epidemic, and I've spoken about those in the House. There's been several epidemics in our First Nation communities. I was up in Tataskawayak when there was 19 suicides that happened, young people. So I'd ask the minister, how many suicides have there been in Manitoba over the past 5 years, and if the minister can provide a breakdown by demographic?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. Okay. So the development of a provincial suicide prevention strategy is a priority for our government as identified in both the Mental Health and Community Wellness 5-year roadmap and the 2022 speech from the throne. The strategy will build upon existing supports to create a provincially coordinated approach for the prevention of suicide with a special focus on at-risk populations. Investing in evidence-based mental health promotion in schools through programs like Indigenous Youth Mentorship Project, Project 11, Thrival Kits is a key part of our efforts to promote the mental well-being of all children. Suicide numbers fall under the Chief Medical Examiner's Office, but I will read the numbers that I have from 2018. The total number of individuals who passed away from suicide were 236. 2019, 232. 2020, 215. 2021, 198. And the 2022 numbers haven't been posted.
The Honorable Member for Point Douglas.
I thank the minister for looking that up and actually providing those numbers. I wish that would have went on for the duration of our couple of days here, because it could have made, I think things go way more smoothly. I don't have access to those numbers, neither do the public, so, it's being transparent and helping guide the direction that this government needs to go. I didn't hear it broken down by demographics. I'm hoping possibly the minister could undertake that if they can't provide it right now. And then the minister did reference that there is a provincially coordinated plan for the prevention of suicide among children, youth, and adults with a special focus on at-risk communities and populations. When will this plan be completed? Will it be publicly available? And when will it be implemented?
The Honorable Minister of Mental Health and Community Wellness.
Okay, thank you. Which would you like?
The Honorable Member for Point Douglas.
I can break the questions down if that's what the minister's asking. I put those together so that they all kind of combine each other. So I asked, when will the plan be completed? So the minister referenced the provincial plan, coordinated plan for the prevention of suicide among children, youth, and adults. When will this plan be completed?
The Honorable Minister of Mental Health and Community Wellness.
Thank you. So the provincial coordinated plan is, after December 2023, it will begin. But we haven't been waiting for that start. That's why we've been making some investments in youth and adolescents to support the needs that they have. It'll be publicly available at that after December. And the timeline, the implementation is a 3-year plan, and it will be implemented over those 3 years as discussed with stakeholders. Now, the demographics. Okay. So the demographics we have in 2018. Okay. I just need to, do you want broken down per, sorry, through the chair? I don't know how this is through like 20 to 30, 35 to 39. That's, I don't know how in depth. No?
Member for Point.
Screen down.
The Honorable Member for Point Douglas.
I would say by maybe gender as well as age.
The Honorable Minister of Mental Health and Community Wellness.
Okay, thank you. So in 2018, there were 162 males, 74 females. In 2019, 172 males, 60 females. In 2020, 150 males, 65 females. In 2021, 122 males, 64 females. Okay, so in 2018, ages 10 to 19, 25. 20 to 29, 63, 30 to 39, 28, 40 to 49, 31, 50 to 59, 44, 60 to 69, 28, 70 to 79, 8, 80 and older, 9. In 2019, ages 10 to 19, there were 22, 20 to 29, 55, 30 to 39, 50, 40 to 49, 29, ages 50 to 59, 35, age 60 to 69, 27, age 70 to 79, 9, and 80 and older, 5. In 2020, ages 10 to 19, there were 16. Ages 20 to 29, 55. Ages 30 to 39, 52. Ages 40 to 49, 32. Ages 50 to 59, 26. Age 60 to 69, 21. Age 70 to 79, 7. 80 and over, 6. And in 2021, ages 10 to 19, there were 29, 20 to 29, 49, ages 30 to 39, 37, age 40 to 49, 24, age 50 to 59, 25, age 60 to 69, 13, age 70 to 79, 16, and age 80 and older, 5.
The honourable member for Point Douglas.
Over the past year, multiple First Nation communities have declared states of emergency due to suicide epidemics. Can the minister explain what she's doing to help reduce suicides and improve mental health, specifically in First Nations, and as well as providing the numbers for 2018, 19, 20, 21 based on Indigenous ancestry?
The Honourable Minister of Mental Health and Community Wellness.
Thank you. So investments that we have made in the Indigenous mental health services are $850,000 for the virtual crisis stabilization unit and telepsychiatry services, and investing an additional $538,000 in the one-time funding to expand the telepsychiatry assessment services. This will improve timely access to the mental health services for adults from First Nations communities and rural health facilities, while reducing wait times and unnecessary patient transfers and admissions. On January 24th, 2023, announced an investment of $893,000 in a new Indigenous-led RAM clinic at the Aboriginal Health and Wellness Centre to ensure culturally safe programming and services are offered to Indigenous peoples by a culturally informed workforce. And the RAM clinic will also work with the Manitoba Mobile Addiction Medicine team to enhance community capacity and access to provide ongoing virtual support to rural and northern residing Indigenous peoples. Mental health and community wellness currently provides funding and oversight to the Indigenous Youth Mentorship Program, PAC Stream Makers, Winnipeg Aboriginal Sport Achievement Center, Indigenous Women's Healing Centers, Addictions Counselor, Mama Way Centers, sorry, I don't want to say that, Centers Solvent Abuse Program. And the last question you had with the Indigenous ancestry, we will have to take that back and take it under consideration.
The Honourable Member for Point Douglas.
I appreciate the minister taking that under advisement and getting those or the demographics back to me. My question wasn't answered though. It's specific to First Nations, but that's fine. I'll conclude my questions and wrap up.
Hearing no further questions, we will now proceed to consideration of the resolutions. At this point, we will allow the virtual members to unmute their mics so they can respond to the questions. I don't believe we have any. Resolution 24.2. Resolved that there be granted to His Majesty a sum not exceeding $32,749,000 for mental health and community wellness, mental health and recovery for the fiscal year ending March 31st, 2024. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.3. Resolved that there be granted to His Majesty a sum not exceeding $13,364,000 for mental health and community wellness for the fiscal year ending March 31st, 2024. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.4. Resolved that there be granted to His Majesty a sum not exceeding $72,079,000 for mental health and community wellness, physician services, psychiatry for the fiscal year ending March 31st, 2024. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.5. Resolved that there be granted to His Majesty a sum not exceeding $318,703,000 for mental health and community wellness, funding to health authorities for the fiscal year ending March 31st, 2024. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.6. Resolved that there be granted to His Majesty a sum not exceeding $820,000 for mental health and community wellness, cost related to capital assets of other reporting entities for the fiscal year ending March 31st, 2024. Shall the resolution pass? The resolution is accordingly passed. Resolution 24.7. There are no monies allocated for Resolution 24.7 this year, so there doesn't need to be a vote. The information was included in the books to reflect change from last year. Resolution 24.8. Resolved that there be granted to His Majesty a sum not exceeding $1,600,000 for mental health and community wellness, other reporting entities' capital investment for the fiscal year ending March 31st, 2024. Shall the resolution pass? The resolution is accordingly passed. The last item to be considered for these estimates is item 1 brackets A, the minister's salary contained in Resolution 24.1. At this point, we request the minister's staff leave the table for the consideration of this last item.
We've got 30 seconds. We have to go through the rigmarole.
Thank you.
Okay.
Okay.
Wait.
You guys are good.
I'm guessing no questions, no motion. Okay.
Resolution 24.1, resolved that there be granted to His Majesty a sum not exceeding $1,567,000 for mental health and community wellness executive for the fiscal year ending March 31st, 2024. Shall the resolution pass? The resolution is accordingly passed.
This completes.
This completes the estimates of the Department of Mental Health and Community Wellness.
Yeah, it'll be 5 p.m. Committee rise.
The hour being 5 p.m. Committee rise.
Thanks.
Thank you.
Hey, right on time. Look at that.